Hello, this is Chris from In the Mess, and I'm here to talk about clinical fellow posts. So what is a clinical fellow post? A clinical fellow post is a non-training post for doctors who have completed foundation training who wish to develop their skills in a clinical area. Typically these posts last from 6 months to 12 months. Clinical fellow posts vary hugely across the UK, and you should familiarise yourself with what your local hospital advertises. Some clinical fellow posts may be entirely clinical, whilst others may have non-clinical commitments such as development, teaching or academia. Many clinical fellow posts are advertised at the junior rota tier, however some are designed for people at registrar or pre-consultant level. Clinical fellow posts are a great opportunity for people who wish to develop their skills and experiences in a specific area. Perhaps you're not sure about what training program you wish to apply for and want to get broad experience, or perhaps you do know what you want and you wish to have more time and experience within the department. Therefore, a clinical fellow year can give you the necessary experience and the time to build your portfolio for job applications. Core and specialty training applications are becoming more and more competitive each year. Therefore, doing a clinical fellow year may give you the edge compared to other applicants. You can use your time in a clinical fellow post to develop your experience in a specific specialty, or take the time to develop your portfolio. A clinical fellow post may give you the opportunity to work in an area that you haven't worked before. This may include remote and rural areas, or perhaps larger cities. Although clinical experience can be gained through locum posts, clinical fellow positions often give extra support and engagement from the department, and this in turn means more engagement with quality improvement, teaching and academia. Many clinical fellow posts are structured to include non-clinical time, and this gives you the opportunity to work on your academia, quality improvement, during paid working hours. What to expect from a clinical fellow post varies hugely based on the area of the country, the hospital and the department you're applying for. Many posts are advertised as clinical development fellow posts, CDFs, and include designated non-clinical time called development time. Others may be advertised as clinical teaching fellows with designated time specifically for teaching. The less than full-time clinical component can be in various proportions, anything from 20, 50, 70 or 80% clinical in proportion to non-clinical activities. Therefore, you might be rotated to work 4 days of the week on the wards and 1 day of the week on teaching. Whilst a clinical fellow, you do need to continue maintaining your portfolio, and this includes work-based assessments such as case-based discussions, mini-KEXs and observations of procedures. Development time is often a self-directed, non-clinical working day. These days are designed such that you can develop yourself in an area that is relevant to the department you are working in. This may involve completing an audit cycle, presenting at a local meeting, or running the departmental teaching program. This may involve also demonstrating the ability to perform skills relevant to the department. If you're more interested in teaching, you can use your development time to get more experience in these areas through performing postgraduate PG Cert in medical education, getting involved in simulation training, or other aspects such as OSCE examination. Some posts are advertised as academic clinical fellows. These academic posts often work closely with the university. You may have a designated academic supervisor who will help you get involved in clinical research. Some fellow posts are entirely clinical and involve no development time. These are useful in order to develop the clinical skills relevant to the department you're working in. They still provide a lot of experience relevant to your portfolio, but you may need to do some work in your own time. In summary, clinical fellow posts are a great opportunity for people who want to develop their portfolio and skills for future job applications, and are a great option for any doctor who doesn't want to go straight into a training post. Don't forget to like and subscribe so you don't miss a thing.